So I think so. I think that's all the protocol kind of stuff. So on mute, camera off once we get started. And then you can use your chat as we go through, as Scott goes through the presentation. If you have any questions, feel free to put them in the chat. We're going to monitor that. I think Beth is taking notes again. She probably doesn't know that, but she started the script. So the liaisons will kind of keep track of all the questions and things that come up. The presentation will be sent out to you later. Plus, we're looking at doing questions and answers. So questions that came up in both sessions and answers with them to help out. So anyways, thank you for all joining us today. Now it's weird because all I'm seeing are people's letters up on the screen instead of getting to see you all. But thanks for joining us today. If you haven't met me, I'm Judy Smith, and I'm the Director of Community Resources, where FCSS falls under. So what we wanted to do today is give you some information about the strategic alignment work that we did, that you were all part of. And but before I start that, I just wanted to take this opportunity to thank you all for the great work you've done during this really difficult time. We know during COVID, it's turned everybody's world upside down, but we're especially impressed with the creativeness and innovation, the partnerships, the figuring out how to work as best we can together to get services out to our community. So I really wanted to thank you and commend you for all of you for doing that. We've been so impressed with the innovation that's happened, how people have really looked at how to do things differently. And we're hoping as we go forward, you'll take those lessons and those opportunities and learn from them. And we learn together as a group and use those to move us into doing things differently moving forward, that we don't go back to what we were doing before, that we've taken the lessons that we've learned from being innovative, having strong partnerships and collaborations, and move in a different way. So just wanted to thank you all for that, because I know it's been a hard time, and needless to say, that's why we changed some of our way of doing things this year, and not taking renewal applications for people that were up, and just extending people for another year. So with that said, today's presentation, Scott Cameron from Bassa Innovations has been our consultant on this work. And so he's going to lead this presentation today. And I've got to tell you, I feel very fortunate that we've had Scott doing this work with us. He understands FCSS. He knows what we're trying to accomplish, and he's been a pleasure to work with. So as I told you, it's being recorded. Remember, camera off, mute on. And if you have any questions or things you want to ask, put them in the chat, and we'll have a Q&A time at the end. All right, over to you, Scott.
Great. Thanks, Judy. I'm getting a message here saying that I'm presenting my screen. So if I'm not, somebody just send me a note in the chat area, and I'll do what I need to on this end. But so thank you. It's my pleasure to be here and presenting this information to the group. And I would like to just stop for a moment and thank Judy and her team. This was an interesting time to be trying to do this work. We made lots of adjustments and changes, and I'd also like to thank each of you as well, because the intent was to get out and see you in person more often than we did, but we adjusted to be compliant with our current pandemic situation. So for those of you that took the time to reply to surveys and provide comments, thank you very much, because you really did help to create the foundation for this work moving forward. So just to review, the purpose of this work was to create context for Edmonton FCSS to conduct its business within the strategic branch priorities, which are new to the organization. It certainly isn't throwing the baby out with the bathwater. It's enhancing what is already happening in FCSS, and being strategic and trying to align that work to a direction that the city is wanting to achieve. And then taking everything that we learned about the strategies and how they all fit together and creating a funding model that allows for decision making or supports a decision making that is consistent with the strategic direction. In terms of the process, one of the first things that we wanted to do was define prevention. In the Act and regulation, it talks about FCSS providing supports at the earliest possible opportunity. So providing preventive supports at the earliest opportunity. And we needed to really understand in Edmonton, what does that mean? Because it might look a little bit different in each community. And of course, every community that participates in FCSS has some latitude in terms of determining the direction that they're taking it. So then we want to review the strategic priorities within the context of prevention, the definition that we'd come up with. That involved doing a literature review. We developed a matrix that looked at each of the strategic priorities set out by the branch and what that looks like through the lens of prevention. Then did some prioritization and criteria development, and finally pulled it all together in a funding model. So, of course, I've identified that you folks were an important stakeholder group in the development of this this project, but I also just want to acknowledge the FCSS team, the volunteers, so the FCSS committee and members of the Community Services Advisory Board. We reached out to members of the extended leadership team throughout the process, just so that as we started to do one thing in one area of community development, that it wasn't going to be adversely affecting other areas of the city's objectives. And then we also had some key informants. So other government and human service organizations like United Way and Children's Services. And we reached out to the executive director of FCSS provincially and received his input as well. In terms of the process, we started by doing a mapping exercise with members of the FCSS team. And it was really just an exercise to bring to the surface all those different things that were already happening in FCSS. It was an opportunity to reflect back on things that were really working well in the process, things that could be enhanced to make the process even stronger. And we actually gathered a lot of information and insights into some of the key questions that we needed to take a look at as we went through the process. Those of you that ventured out on a very snowy, I can't remember what day of the week, morning it was in Edmonton, participated in our defining prevention workshop and really laid the groundwork for this work moving forward. And, you know, it was important to the FCSS team and to myself that you start with those folks that have such a significant investment and interest in the process. And of course, that's you folks. We moved then to work with the FCSS committee and explored some ideas, some principles, priorities, and criteria that seemed to emerge through the mapping process. And we used that preliminary work of the FCSS committee to build the survey that we sent out in February and received, some really great responses and input. We extended that deadline a little bit because of COVID-19. And once we sent the reminder out, we got a number of additional responses. So thank you, all of you, for providing input in that process. We continued to work on the literature review based on some key concepts that were coming through the work to date. And it provided the content for the strategic alignment matrix, and then began to roll it all together in looking at the process mapping and looking at the process pieces that needed to be included in the funding model. So I'm going to just start to unpack some of what we found. Of course, Edmonton FCSS is the sponsor, so that is the lens through which we wanted to look at the other strategic priorities identified by the branch: ending homelessness, reducing poverty and social inequality, advancing reconciliation, increasing the supply of affordable housing, and creating safe and healthy communities. I'm not typically going to read what I've got on the screen, but I recognize that there's some of you that are doing this by telephone, and so you may or may not be seeing the screen. So I'm going to see if I can articulate so that it doesn't seem like a blur, and it's an effective use of your time. So one of the first things we want to do is take a look at what the interconnections are between each of these strategic priorities, and then where the interconnections were between those strategic priorities and Edmonton FCSS. As I said, we started the process by trying to define prevention, and we have defined prevention, 2 actual levels of prevention. So prevention is determined to be the active pursuit of individual, family, and community protective factors that lead to the well-being of self and others. So I'll just unpack a few of the key words in there. 2 of them in particular I remember distinctly coming from input from yourselves. One was the word active, that it isn't just something that you hope will happen, but that you're actually doing something. So prevention is a verb. And the other thing was the addition of self and others. So the notion that in order to create well-being for others, you also have to be well yourself. And then, of course, the words protective factors, which I will unpack a little bit further on in the presentation. Early prevention then occurs when the protective factors identify, address, or modify risks before restorative supports are required. So there were some concerns around the word early that I heard both in the in-person session and also through the survey. And that was this notion that early might be related to early childhood, and it isn't. Early childhood is maybe a great spot for early prevention, but the 2 uses of the word early shouldn't be confused, because anybody at any age can experience risk factors that may be new to them. And so in this context, early means getting to address those risk factors with the appropriate protective factors before intervention or treatment is required. So we're starting to bring in some key concepts here, one being risk factors and the sense of creating vulnerability, the other being protective factors, which is the opposing force that builds resilience. So let's look at this in the context of intervention and treatment. And anytime we're talking about FCSS, we're talking about the context of individuals, families, and the community. So early prevention can happen at any one of those 3 levels. We talked about early prevention and prevention. Intervention then is a level of support designed to improve knowledge, skills, and values needed to change behaviors and the trajectory of risk factors. So something is already happening, it's having an impact, and it could get worse if something isn't done soon to improve knowledge, skills, and values, and to be able to change those behaviors. Treatment then is a level of support designed to improve knowledge, skills, and values needed to cure, eliminate, and or reverse the effects of risk factors. So by design, FCSS isn't intended to intervene and provide treatment. Intervention and treatment in terms of any long-term intent is beyond the scope and the mandate of FCSS. So where FCSS does its best work is on the prevention side, trying to provide those protective factors early enough so that people don't necessarily need to find intervention or treatment. Hopefully this will all become a bit more clear as we continue to move through. So just a different version of one of the earlier slides showing the individual's family and community at the center of these strategic priorities. Typically what we're seeing is that risk factors are things that are coming in and impacting individuals, families, and community from the outside. And the protective factors are those things that we're then trying to build within individuals, families, and the community to push back against the risk factors. And we'll dive into this a little bit more now. In terms of risk factors, they're the characteristics, conditions, or behaviors that increase the likelihood of harm among individuals, families, communities, and the larger society. So let's take a look at what some of those risk factors might be in the context of FCSS. Things like poor parenting skills, lack of social network, low income, low self-esteem, no sense of belonging, racism, discrimination. Those are all risk factors that push and create vulnerability among individuals, the community, and families. To counteract that, then, we need to start building protective factors, which are the conditions or attributes of individuals, families, and communities, and the larger society that mitigate or eliminate risk leading to enhanced well-being. So again, they're the things that push back against the risk factors, and they create resilience in people. Some examples of protective factors include parenting skills, enhanced coping skills, a sense of belonging and hope, celebrating and honoring traditional teachings, exposure to ceremony, self-determination, positive school and neighborhood environments. Those are the types of things, it's the protective factors that FCSS will be looking for community organizations to build into their programs and services. What you're really trying to achieve is instilling these protective factors in your program participants. Let's talk a little bit about the community input that allowed us to go from this space to the actual FCSS funding model. So we looked at input to develop the definitions, principles, priorities, and criteria. And the report that you'll receive does have definitions embedded in it around things like family, which is, we've taken a very broad perspective of family. Risk, protective factors, which we've already talked about the definitions. Prevention, intervention, treatment, we've already talked about those definitions, as well as things like social well-being, access, and community development. The funding model is really broken into three areas. One is the funding principles, the second is priorities, and the third is criteria. So the principles are the rules and beliefs held by the organization that guide their actions. And it's positioned sort of at the top end of the funnel here because it's the broader principles that help to guide FCSS. The funding priorities are the broad programmatic outcomes and allocation formulas desired by Edmonton FCSS to achieve their objectives. So it's taking a look at those things that are being proposed to be funded and seeing how they line up with the direction that the City of Edmonton and FCSS is intending to move. And the third area is criteria, which are the investment conditions that need to be met to help achieve the principles and priorities. So those things that need to be in place to know that it's going to be a strong investment. In terms of what the funding model is intending to achieve, it's to help you strengthen your proposals. By giving you the information, by sharing with you what Edmonton FCSS wants to achieve, it allows you the opportunity to be able to be more concise and deliberate in terms of what you're asking for resources to accomplish. We're looking, the criteria is used to help determine the strengths and capabilities of the organizations applying for FCSS funds. It's important that FCSS is making good, strong investments, and that needs to be in good, strong organizations. That is not to mean that bigger organizations are necessarily better than smaller organizations, or that volunteer organizations aren't as worthy as those that are fully staffed. It's about strength in organizations, and there are clues within the funding model to help you look at those things that are important in terms of having a strong organization. Having strong programs that are well designed to achieve intended outcomes, that there's strong alignment between what Edmonton FCSS is funding and the direction that's being asked of FCSS by the city. And also that there's strong evaluations, that monitoring and evaluation happens so that there's this opportunity for adaptations and continuous improvement and the ability to demonstrate or show the value of FCSS funded programs and services. How does it flow? It starts with Edmonton FCSS articulating clearly what the municipal expectations are so that organizations can create strong proposals, that there's good criteria and evaluation tools in place to make rational decisions, that ultimately the services help to achieve the strategic directions set out in the provincial mandate, that organizations can evaluate the effectiveness of their programs and services and use that evaluation information to help modify expectations and adapt the program over time. How the decisions are being made sort of follows this model. First of all, there's an assessment by the FCSS team relative to criteria, and I'm going to take a closer look at each of criteria, priorities, and principles. The priorities are assessed by the FCSS committee with support from the FCSS team. The principles are then reviewed by FCSS leadership with the FCSS committee and the Community Services Advisory Board, leading to recommendations and ultimately decisions. So let's take a look at the criteria. As I said, these are the investment conditions that need to be met to help achieve the principles and priorities. So outcome measures, what's really being evaluated here is the organization's demonstrated ability to track and monitor outcomes. It's not the outcomes themselves per se, it's the ability to be able to do the work. Same thing with financial management. Every organization is going to face some difficult times in the history of their own organization. But if they have strong financial and accounting management policies, procedures, and reporting, it's not so much where the what the financial situation is of the organization, as much as it is their ability to be able to see it and address it. Program delivery is that it's one thing to have a well-designed program, but it's another thing to be able to have the resources and the expertise in place to actually deliver on a well-designed program. Governance is that there's a leadership model that's defined and exhibits strategic direction and control. So it doesn't say what that governance model needs to look like. It could be heavily volunteer-driven and light on the staffing side, or it could be the opposite. It could be heavier on the staffing side and lighter on the volunteer side. But the model is clearly articulated in terms of how leadership flows in the organization. Capability is the ability of the capacity or the ability of the organization to actually conduct their financial management, governance, and accountability. And then past performance is also something that's important. It's the ability of the organization to be adaptive, to engage in organizational learning, and to continually monitor so that they can move to continuous improvement and achievement of the intended outcomes. The priorities then are assessed, as I said, by the FCSS committee with support from the SFCS team. And here are the things that they are taking a look at. Certainly alignment. How does the program or service that's being proposed align with Edmonton FCSS, what the citizens are needing and wanting, the service providers, the City of Edmonton, and the Province of Alberta to make sure that everything is working in concert and that FCSS is doing what it does best. The target populations. So how well do the organization understand who they're serving? What are the needs of the clients that they're trying to trying to support, and how does that align to FCSS? An acknowledgement around a comprehensive approach that FCSS isn't meant to be all things to all people all the time. So the comprehensive approach is how does the program or service being proposed fit with other programs and services? So how do clients transition through programs and services? How do they graduate or move beyond a program or service that's being delivered? Or even how do they enter into the program or service? Program design. I mean, I think when you folks saw the survey, the program design piece was probably 5 or 6 different potential priorities, and they came together in this particular one. So it's about how the program is designed to achieve its intended outcomes. Evaluation here is not whether you have the ability, but that you have clear and succinct outcomes. So they're connected to what you're trying to achieve, and they're a good representation of the achievement of your outcomes. And then multiple opportunities for engagement, that there's that diversity, the diversity that you have in your community can find itself, everybody in your community can find themselves in the programs and services that you're proposing. The principles then are reviewed by FCSS leadership, and this is meant to be sequential, that the criteria starts and then the priority assessment and then finally the principle side. And the principles are around accountability. These are public funds. Edmonton FCSS is accountable for these funds, and therefore expects that the programs and services that they fund will also be accountable. Edmonton FCSS values partnerships and working collaboratively. So anything that organizations can do to help one another, to support one another, build strong relationships, and therefore a strong sector are valued by Edmonton FCSS. Significance. It's important that organizations receive the funds that they require to achieve their intended objectives. So it's not prudent for Edmonton FCSS to give organizations small amounts of money that leave the organizations somewhat crippled or handicapped from being able to achieve what they're trying to achieve. So significance is an important principle that has emerged out of this process. Stability. Certainly Edmonton FCSS recognizes that if they're moving funds around continuously, it really makes it difficult for community organizations to achieve what they're intending. And finally, sharing resources. Not necessarily money, but it's about knowledge, insights, and results. So when one organization is finding something unique or different or consistent, whatever they're finding, if they share that with other organizations, it helps to strengthen the sector overall. So again, the decision-making model starts with the criteria, which I have listed over on the left-hand side, moves to the priority assessment, and then finally the principles before recommendations are formulated and decisions are actually made. And that is the essence of the strategic alignment and funding model report. Judy, I'm going to hand it over to you again.
Sure. So I think I know that's quick and it's hard for those of you on the phone that couldn't see. So that's why we'll get the presentation out to you and the questions and answers. But we'll just see if anybody has, does anybody have any questions now? You can shoot them in the chat or go off, put your video back on so we can see you and I'll know you want to ask a question. Hi, Rochelle.
Hi, Judy. I just had a question. So the strategic, the new funding model, when will that start taking into effect?
That'll be in effect for 2022, because all of our agreements are going to continue through 2021. So that'll give us the rest of this year and the early next year to get everything sorted out, to answer all the technical questions that people will want around applications and what do I need, right? We want to make sure people have time. So that gives us, you know, a good amount of time to get everything into place.
Okay, great. Thank you.
Thanks. Don't be shy. So quiet. I guess a couple of the things I'll mention that came up in the last group was someone talked about, you know, people's economic status, right? And I think Scott covered that pretty well in this presentation, that we're really talking about the risk factors people face, and that makes them vulnerable, and how we're going to support them in that. So that piece around where do you fit in the economic scale of things doesn't really fit into this model. It's more of those risk factors that we're trying to work on. I was trying to think, there was one more question that I thought, oh, someone wanted more specifics around what the priorities were that we'd be aligning to coming up for 2022. And that's still a piece of work that we have to work out with our branch around what pieces of work, what risk factors are already, what are we already working on in the branch through different pieces of work, and what areas do we want FCSS to focus on. Did someone have a question? I thought I saw somebody's mute go off.
Hi, Joe. This is Mayada. I do have a question.
Great.
Yes. First of all, are you planning in early 2022 to have workshops for similar organization or organization offering similar programs to get together and kind of like brainstorm and develop the programs together, or exchange perspectives and ideas? And that's part one. And the other question would be, by 2022, what kind of input are you expecting from us as organizations to help you with? How can you be of any contribution to this beautiful, phenomenal model?
Well, I think you have been part of creating this model in how we go forward. Now it's that alignment with the city priorities that we want to work out. And I think we'll still work with you as our funded agencies around how we can best, you know, we want to streamline a system, and I think we've done a great job over that the last few years of trying to simplify our systems, and we don't want to make things complicated again. So I think that'll be one of the ways. We will have to have workshops on different pieces of that, and we haven't figured that part out yet. That will be probably in 2021 versus 2022.
Okay, thank you.
Val?
Yeah, so if I'm hearing you correctly, and I might not be, is this saying, so let's say for 2022, the priority is poverty reduction, or what? So would your applications for that funding year be targeted around that, and then the following year could be on something different? Is that the way you're envisioning that, or how? Or is it to tell?
I don't, like, we would pick a priority, like you said, we'd identify something, but I think it would be, we recognize we can't flip priorities every year, or we'll never make any changes to anything. So I think it would be, priorities would be established for, I'm making this up right now, but I'd imagine they'd be priorities for 3 to 5 years. Okay. And then hopefully we can make, you know, a dent in things. And that's the idea, right? To have a bit more focus so we can actually start making some significant impact on some things.
Great. Thank you.
Thank you.
Judy, if I could just comment.
Sure.
If you look at some of the protective factors, let me just go back to that slide. some of these protective factors you're going to find across the different strategic priorities. So coping skills are being needed by people experiencing poverty, people experiencing a housing crisis, people experiencing racism, discrimination, homelessness. So part of the development of the matrix was to take a look at what are some of the common protective factors across these different strategic priorities, so that as FCSS is working in that prevention realm, you're actually preventing people, you're preventing intervention and treatment of multiple strategic priorities. So there may be a focus in one area or another, and that's to be determined by Judy and her team and the folks at community development. But you'll find that a number of these protective factors do span different risk factors.
Thanks. So there was a couple questions in the chat. One was to ask me more about what I was talking about around the economic factors. It was just a comment around someone in the last session asked us about families or people that you work with around their economic situation, how that factored into things. And what I was trying to say was, when you're looking at prevention, we're not looking at people's economic situations. We're looking at where they're most vulnerable and what risk factors are in their life that's making them vulnerable. So that's all I was saying about that. And then I think the other question, I'm afraid to pop the chat up all the time because I think it's going to go in the recording, which probably will, is around how many protective factors would a program be expected to have? And I don't think that's something I can answer. I think as people are developing their programs, they're going to have to be looking at what they want to achieve through their program, in identifying what the risk factors are they're going to work towards and what protective factors they'll be using. Do you have anything else to add to that, Scott?
No, Judy, I think that's entirely, as we see it. Some of the risk and protective factors have really nice direct alignment. And the same, the other thing is, having too many protective factors means that you're trying to evaluate on too many or multiple levels. It'd be better to see, some real progress on some real key protective factors, as opposed to watering down a program, trying to address too many things.
Judy, can I just add a comment? I think the other kind of piece of that is that ideally it's evidence-based. There's some research behind it. So in terms of kind of those areas, if the priority is around poverty reduction, and we've identified some common risks across that area and common protective factors, and so then it's like, so what does the research say is going to be impactful, or what do we know based on our past experience is the most impactful in building that resilience for our communities? So it does also include some reflection on and research into what has been effective or what is effective.
Yeah, thank you. I just wanted to remind everybody, like, we're just done this alignment now, right? And all these pieces will come out of that. That's the work that our team will have to take on, and there may be opportunities for you to feed into that as well. And I've had a couple of people ask me through email and stuff. We will get the slideshow out to everybody. And again, we're going to try to put it out along with some questions and answers that people are asking from both sessions, so that everyone has the same information. Does anyone else have any more questions? Comments? It's getting to the end of the week. Everyone's tired. Oh, we have a question. Yay. Go ahead. Go ahead, Megan.
I don't have a question, actually. I just figured you're probably tired of staring at all these blank faces, so I may as well turn on my camera.
Thank you. That was very nice. Yeah, if no one has any more questions or comments, you can still talk to the liaisons or contact me. I'm fine with that. I'm really glad you attended today. I want to, you know, I know it's scary when things change, and FCSS has been pretty just the way it has been going for a long time. And I've got asked a few times about, well, did we not have a strategic plan before? And we've had priorities over the years, but we really haven't, we hadn't taken the opportunity to really get strategic about our focus. And it's funny, we decided to do this before COVID hit and before all the economic and social challenges started to really to escalate. So I'm really happy we did decide to do this at this time, because I think it is going to be helpful for us to refocus. And it is not to say everybody has to align with what we're doing, but we need to, as a city, focus on the outcomes we need to achieve that we've told our council that we've achieved, and the things that community has told council they want to achieve through our strategic plans. So this is our opportunity to really align with that and ensure we're showing good impact and can measure that. And that's for our city council, but also the provincial government needs to see that too, as they're the ones that's providing us this money. So I really appreciate everyone taking the time today. I know you're all busy, super busy, working from home or in the office. I'm working from like the bedroom office. So I just want to thank you all again for attending, and please keep the questions coming to us if you have any, and we will keep you posted as things move forward. So you can pop your cameras on so you can see each other now. Thanks, everyone.